Possibility basis.
Yeah, then we'll start. Okay.
Yes, sir. Sure, sir.
So today's topic given was the different types of Swedana therapies in clinical practices. So next, the presentation includes a brief importance regarding the Swedana and definition different types of Swedanas, general indication and contraindications, and discussion on clinical utility and application of different Swedana therapies, and probable mode of action in general, and the scope for the research in Swedana. So in conclusion, so it's a brief discussion regarding the Swedana. So in one day or one topic, we cannot cover all the Svedanas, but day-to-day practice is what we are practicing and how we are practicing, and judiciously how we can apply the different kinds of Svedanas in today's practice. So almost all the Ayurveda practitioners will get all musculoskeletal disorders or inflammatory connective tissue disorders, and almost all neurological neuromuscular disorders will come up to our OPD. So in those conditions, how the Svedanas will help in OPD basis, because almost all Svedanas what we are practicing can be practiced in OPD basis. So how that the main intention of this presentation is how the clinically practicing Svedas will deal, and how judiciously in what condition we can apply in different diseases. This is the motto of this presentations. Let's begin. So to know about the Svedanas, no place as a Shodhana, because all of you know Svedana is a Pura Karma, so cannot be used as a Shodhana. Pura Karma as it is the Pura Karma to Shodhana. So Pradhana Karma when one among Shadvidopa Karma. So all of you know Shadvidopa Karma, among that Svedana is one. There Pradhana Karma, and Pachat Svedya, that is in Pachat Karma when it will use Shalya Parita, that is after removing the foreign body, in Mudagarbha and Suprachata, postnatal care. It is used as a Pachat Karma. So it is primarily Pradhana Karma when it will act as in the localizing disease or underlying diseases like Janusandhigatavata, Katigatavata, or Gradrasi, where localized pathology will be there. There we can easily, or we can add, or we can use the Svedana as a Pradhana Karma to treat the localized pathologies, underlying pathologies. So main the Swedana is prime modality treatment in Vata Kaphaja Rogas. So Swedana is used for Vata and Kaphaja Rogas, not Pittaja Rogas. So Sweda is a Mala Veda Dhatu, and Karma, its Karma is Kleda Dharana, and Swedana always done after Snehana. Okay. So these are two regarding the introduction to the Swedana. So all of you know this basically, but it is part of this presentation. So the process, the definition is the process by which sweat or perspiration of the body will be produced, or the procedure which induces the Svedana or the perspiration is called as Swedana. So here Swid Dhatu, Dhya Pratyaya, to cook or to write or to perspire or to make the body to perspiration, that is Swedana. So definitions: Stamba Gaurava, Sitagnam, Svedanam, Svedakarakam. This is told by Charaka Sutra 22/11 that Swedana is a procedure which relieves the stiffness, Stambata, heaviness, that is Gauravata, cold, Shitata, and which induces the sweating, that is called Swedana. So coming to the importance as a Puro Karma, Swedana as a Puro Karma. So all of you know the Puro Karmas are Dipana Pachana, Snehana, and Swedana. So among that, Snehana Svedanas are very much important. Why? Because without the Snehana Svedana, the doshas cannot be bring from Shaka to Kosta and eliminated. So that's why if a proper Snehana Svedana is done, we can achieve a better Shodhana in day-to-day practices. So all of you know that one. So how much importance as a Puro Karma? So simile has been given by the Charakas, Sutra 14/5, that is Shushkanyapihi Kastani Sneha Svedopadanai Namayanti Yatanayam Pun Kim Punarjivito Naram. That is told by the Charaka. That is Shushkanapihi Kastani means what? When we use the kasta, that is non-living things, that is like a kasta. For example, if you take a bamboo, that bamboo chair you might be seen that bamboo, that is when you properly it is oleated, that is kept in overnight in the taila or any oil. After that, next day it is given a heat that can bend like any direction and make the furnitures with the bamboos. So that's why Shushkane P Kastane, that is a non-living things. When properly given Snehana Swedana, it bends in any direction. That much flexibility will get. So Namayanti Yatanam Kim Punarjivito Naram. That is Naram. That human being, it's a living things. When properly Snehana Swedana is applied, then definitely we can achieve a flexibility or in any direction. The body can bend in any direction. That is the main intention of the Charaka, to explain the importance of Snehana and Swedana. And next, by Charaka itself is told how the Snehana Swedana will make the doshas liquefy, cleanata, and bring the doshas from Shaka to Kosta. That is Snigdasha Sukshmesha Eneshu, Linam Svedastu Dosham Nayati, Dravatvam. That is, after doing the proper Snehanas, Nigdasham, the doshas which are located in a minute channels, Lina doshas, after giving the Sweda, doshas will get liquefied and those will come to the Kosta. Another one is the doshagati from Shaka to Kosta. That is how the Snehana and Swedana will help the bringing back the doshas, vitiated doshas from Shaka to Kosta. That is Vriddhaya Vishandanat Pakat Sroto Mukha Vishodanat Shakan Mukva Malaha Kostayanti Vayecha Nigraha. That is Vradha and Vishandana. This is done by proper Snehana. Paka and Srotomukha Vishodana is done by Swedana. So Shakan Muktwan Malaha. From Shaka to Muktwa Mala. Mala is considered doshas here. From Shaka, they will leave the Muktwa Malam. They come to the Kosta, then through the Vayu, and they will be Nigraha, and they will be eliminated out. So here the Vradha Vishandana Paka Srotomukha Vishodana. That is Vruddha, that is increased in their own state, and Vishandana is done by Snehana. Paka, that is digestion of that doshas, and Srotomukha, the dilatation of the Srotasis is done by the Swedana. Then they will come to the Kosta, then you will be eliminated easily through the Shodana. This is also importance of Snehana and Swedana. So another one important is Sneha Klinna Kosta Dhatuga Vas Rotalina Echa Shakasti Samstaha Doshaha Svedaste Dravikrite Kosta Nitam Samyak Shuddhirdir Nirhante. This is by Ashtanga Sutra, 17th chapter. That is Sneha Klinna. Due to the Snehana, the Klinna doshas and Kostagata doshas, Dhatugata doshas, and Srotolina doshas will be liquefied by the Svedastu. Then they will come from Shaka to Kosta, then Nida Samyak Shuddhir Birnir. Then from that Kosta, that will be get eliminated. So due to the Snehana Swedana, the Kostagata, Dhatugata, Srotolina Avastha doshas can be bring back to the Kosta and eliminated. Oh, this is the main simile. They have different kinds of similes they have given, and they have explained regarding the Purva Karma of the importance of the Purva Karma as a Snehana Swedana. So next classification, all of you know regarding the classification, there's Dvida, two types of Svedanas, that is Sagni Sweda, Anagni Sweda, that is Niragni Sweda. So here the Sagni, we have used the fire, and Anagni without fire, we have introduced the Swedana. So properties of the Swedana on the basis of properties: Snigdha Sweda, Ruksha Sweda, and site of Sweda, Ekanga Sweda, Sarvanga Sweda. And due to the on the basis of karma of the Sweda, Samashodhana Sweda, where we are using for the Shodhana purpose, Samashamana Sweda, they are where mitigating the dosha, Samashamana Sweda is being used. So Trivida Sweda, that is three types of Sweda: Ruksha Sweda, or that is Valoka Sweda, Snigdha Sweda, Shashtikashali Pinda Sweda, Snigdha Ruksha Sweda, Jambira Pinda Sweda, or Dhanyamla Sheka are considered to be Snigdha Ruksha Sweda. So another Trivida Swedas, Mrudu Sweda, Madhyama Sweda, Mahan Swedas, according to the intensity of the heat, Mrudu Swedas, Madhyama Swedas, or Mahan Sweda has been told by the Charakacharya. So Chaturvida Swedas are explained, that is Tapa, Ushma, Upanaha, and Drava Swedas being explained. So this is Chaturvidas on the four types of Swedas. So Kashyapa, Ashtavida Swedas, that is Hasta Sweda, Pradaya Sweda, Nadi Sweda, Prastaram, Sankaram, Upanaham, Avagaham, Parisheka Swedas. So this is Hasta Sweda, specially explained by the Kashyapa in babies, where with the rubbing of the two palm will give the Hasta Sweda. That is specially explained by the Kashyapine childrens. Okay. So let's start the Sankara Sweda, that is, sorry, Sagni Sweda, that is with the help of Agni. There are 13 types of Swedas explained by the Charakacharya. That is Sankaram Prastaram Nadi, Parisheko Oga Jayantaka Ashmagnam, Kashu Kuti Bhukumbi, Kupa Holakaha. That is Sankaram Prastara Nadi, Parisheka Avagaha Jayantaka, Ashmagna, Kashu Kuti Bhukumbi, Kupa Holaka. So here almost Karshu, Kuti, Kupi, so Kumbi. So they are earlierly in those days they used to use the Svedanas like this, but now we are almost using the Sankara Sweda, Nadi Sweda, and Bhashpa Svedas, some Parisheka Oga Svedas, or Ashmagna Svedas are what we are using in our day-to-day practices. Okay, next Niragni Sweda. Here, without the applying of the Agni, we are producing the sweat, and especially these Niragni Svedas are explained in the Medavarta and Kafavarta. Meda Kafavarta Vata conditions. It is been explained by Charaka, Sutra, 14th chapter. Vyayama Ushnasadam Guru Pravarnam Shuddha Bhupanam Bhayam Upanaham Krodha Ahatam Atapashevanam. That is Vyayama. Here, without the using of fire, how you are inducing the sweating. That is very important. Here, Vyayama, there are three types of mechanism will be happen here. So here either will generate the heat inside the body, either will apply the heat over the body, or will prevent the heat loss from the body. So three mechanism will induce the sweat over here. So Vyayama and Guru Prava, that is Vyayama, and that is Bahu, that is Bahu Yuddha, that is wrestling Ahata. It is where will generate the heat inside the body. That is Vyayama. Due to the Vyayama, increased metabolism, metabolic rate, and increased heat production, and then the sweat glands will be open, and core temperature will be increases, and then there will be increase in the sweat. So Vyayama and Ahata. So this is by generating the heat inside the body, and Shuddha also, Krodha also, Bhaya also there. So we are preventing the heat loss, that is by Guru Pravarna, covering the heavy woolen cloths where there is a heat loss can be prevented, then increase the core temperature, and then ultimately sweat gland will be open due to the hypothalamus. Okay, so stimulation and then core temperature increase ho gaye to then ultimately the sweat glands will be open. So another one is by applying the heat, that is Atapa Sevana. Here we will apply the heat, then sweat will be produces. So three mechanism, either will generate the heat inside the body, either will prevent the heat loss, either will expose to the sun or the heat. Okay, so these three 10 types of Niragni Svedas, and where it can be used is Urustamba or Medo Kafavarta Vata. Next, incorporating of Sagni Svedas, that is told by the Sushruta Ashtangrodaya, where 13 types of Svedas can be incorporated in these 4 types of Svedas. Tapa Sveda, Jhentaka Karshu Kuti Kupa, Olaka, Ushma Sveda, Sankaram Prastaram Nadi Ashmagnam Kumbi Bhu Sveda, Drava Sveda, Parisheka Avga Sveda, and Upana Sveda. So indications, so for easy memorizing or the easy remembrance purposes, I have written in a Srotas wise. Pranama Srotas is Pratishaya, Kasa Swasa Hikka, Mutra Srotas is Mutragata and Mutra Kacharata, Amadosha, Alasaka and Visuchaka, Vatavadi, Karnamanya Shirashula Arditam, Pakshagata Vata Kantakam, Kampana, Kali, Ekanga, Sarvanga Vata, Angamardam, Grudrashi. So in Vata Kafaja disease like Pashva, Krustam, Katikrama, and Galagraha. So special indications, types of Svedas, that's Tapa specially indicated in Kafaja Rogas, Ushma Sveda Kapha Rogas, Drava Sveda Pittanubandhi Vata Rogas, Upanaha Vata Rogas, Niragni Kapha Medavarta Vata Rogas. So contraindications, persons in who daily consumes Kashaya Rasa, Madhyanitya, Garbhini, Pitta Prakriti, and in Pitta Jevaris like Rakta Pitta, Dhagda, Pittameha, Trishna, Shuddha, Kamala. Almost all Pittaja conditions, it is contraindicated. In Tvak Vikara, Kusta, Dhatukshaya, Ati Daurbalya, Ojakshaya, Shukrakshaya, Shosha, Purakshata, Madhumeha, Buddhabramsha, Vishavikara, Madhyavikara, Sthula and Budara conditions. There are where if we give this Swedana in this condition, either worsen the condition or disaster to the body. So this where it should be contraindicated. So now we'll start. This is basic things we have to tell regarding the Swedana. So now clinical utility of Swedana, where and how different kinds of Swedana can be adopted. We'll see that. Understanding of Swedana application. So for Pura Karma you are using or Pradhana Karma, that should be corrected first only. And Agni or Niragni, Svedas we are selecting, that should be selected. Snigdha and Ruksha should be selected, whether you are using in Snigdha or Ruksha. And Sthanika Sarvadaika, selection of specific Svedas, selection of a specific drugs is important, and know how to apply totally unaffected area, because some are tapping, some are rubbing, some are squeezing type of totally Svedas are there. And always check the temperature prior to the apply on the body. So always the temperature should be checked on the dorsum of the hand of the therapist. So this understanding of the Sweda applications first. Sweda as Puru Karma, Alapinu Sarvanga Bhaska Sweda, Usnodak Snana in Vamana and Virechina as a Swedana as Puru Karma, Sarvanga Sweda or Stanika Bhaska Sweda in Basti, Nashya, Shraveda. Nadi, Prastara, Sankara Sweda and Swasa, that is Atyaika Vasta, Anagni Sweda, Kafa, Medavrata Vata, or Gustamba Stole conditions we are using as a Puro. So, Sweda as Pradhana Karma. So, here we will start the different kinds of Ruksha and Snigdha Svedas where we can use that. So, you know all Sankara Sweda, all Potali Svedas or Pinda Svedas are considered to be under the Sankara Svedas, so Pinda Svedas or Potali Svedas, all same. So here two kinds of Potali or Pinda Svedas will be there. One is Ruksha Sveda and Snigdha Sveda. So Ruksha is, that is different kinds of Ruksha Svedas are Churna Pinda Svedas, Kusha Pinda Sveda, Valuka Pinda Sveda, Lavana Pinda Sveda, Danya Pinda Svedas, or that is our Ruksha Svedas. Snigdha Sveda, Patra Potali Sveda, Shashtika Shali or Mahasha Mamsa Pinda Sveda, Chambira Pinda Sveda, Kukutanda Sveda, Chinchalavana Pinda Svedas, all are Snigdha Svedas. So we'll see one by one. So here, where to apply Ruksha Sveda, where to apply Snigdha Sveda. The conditions are criteria to select them. So in Ama Yukta conditions, we select the Ruksha Sveda. In Nirama Yukta conditions, Snigdha Svedas. Kapha Samsrishta, Kapha Vrita Vata, you select the Ruksha Sveda. Snigdha Svedas, Vata Pradhanya or Vata Pradhana Kaphaja Rogas, you select these Snigdha Svedas. Ruksha Sveda selected in inflammatory conditions, whereas Snigdha Sveda is selected in non-inflammatory conditions. Example for the Ruksha Svedas are Amavata, Urustamba, Vata Kantaka, and Snigdha Svedas are Vata Kavaja Grudrasi, Avabavuka, Sandigata Vata, different kinds of Snigdha Svedas can be selected over here. So this is how to select the Sweda Ruksha and Sweda in different conditions by clinical approach. Okay. Selection of Ruksha Svedas. So common indications all of you know Ruksha Svedas. Amavata, Vata Kavaja Manyastamba, Grudrasi, Sama Sandigata Vata, that is inflammatory conditions, Granthi and Urustamba. And all mentioned drugs can be selected for Ruksha Sveda. All mentioned I told no that different kinds of Ruksha, Valuka, Askar, the different kinds of Svedas that can be selected for the Ruksha Svedas. Application of Vata Kafara Tailas first before applying Ruksha, that is Brad Sendavari Taila, Murchita Tila Taila, Maha Vishagarpa Taila, or Patumchikadi Taila can also apply before Ruksha Sveda. So first we'll start with Valuka Sveda. It's a Ruksha kind of Svedas. How it can be or where it can be judiciously applied. So almost Valuka Sveda, all of you know, the sand is collected and it is heated and it made into pottery and applied over the affected area. Why is Valuka has been selected? Because it having the heat retention capacity is more. So that's why Valuka has been selected. So Sama Roga conditions where Ama is existence and Amavata, Granthi, Urustamba, Kafa, Meda Urtavata, Medo Roga, Urustamba and Katigraha conditions, this Valuka Sedra or can be selected. And so it can be used for more time, and with the Valuka Sveda we can cover the area, more areas to cover, and repeatedly it is required. And application is very much important. Soft touch on the affected part. We cannot keep it longer period. So because it may burn. So soft touch on the affected part is very important. No need to change the everyday. So easily available and no need to change the everyday. That is Valuka. So that's why it is important and easily available. That purpose Valuka has been selected in Valuka. Okay. So avoid tapping, keeping over the longer time. So this is some points just to be considered under Valaka Sveda. So in practice, Samaroga, Amavata, Granthi, Urustamba, Kapha, Veda, Urda, this condition should be considered while using the Valaka Sveda. Next, Churna Pinda Sveda. All of you know, Churna Pinda Sveda, different kinds of churnas will be selected and they made into bottles, and they'll be by indirect heating method, we will heat them and we will apply the affected area. That is Churna Pinda Svedas. That is Podikiji. That is in Kerala, it is called as Podikiji. That is, it is applied in the different kinds of conditions like Vata Kafaja Manyastamba. If it is stiffness related, Vata Kafaja Manyastamba, Hridrashi conditions, Katigraha, Sama Sandigata Vata, Ama should be there, Sayanama Sandigata Vata, and Staule conditions, it is used. Churnas which is having Ushna and Tikshna Guna should be selected always. So different kinds of day-to-day practices where what we are using in Churna Pinda Svedas are Rasanadi Churna is one, Vaishnavara Churna we are using, Pola Polatyadi, Utumchikari Churna, Tripala Churna, Dashamula Churna, Jatamayadi Churna and Nagaradi Churna are different conditions. We are selecting the churnas and we are made into potalis and we are applying over that. So during this, in this churna, add Haridra, Manjista and Khadira churna to avoid skin rashes or allergic reactions. So along with these churnas, add Haridra, Manjista and Khadira churna to avoid the skin rashes or allergic reactions. So in practices we are using, and change the churna daily or 3 days once. If possible, if affordable patient is there, you can change daily, but 3 days once also we can change, no problem. So heat the pottery indirect methodly and check the temperature before application over the patients. In each and every pottery Vedas, always temperature should be maintained very well, and always the pottery heat should be checked to the dorsum of the hand of the therapist before applying over the patient. So this is regarding the Churna Pinda Sveda, should be applied in Vata Kapaja Manyastamba and Viradrashi, where Sama condition is, Kapha condition is there. There different kinds of Churna Pinda Svedas are being used. So Tusha Pinda Sveda, all of you know, husk is used here. That is cost effective and but not available everywhere, but you can store it, no problem. So tie the pottery medium tight. Here some loose type, because in Churna Pinda or in Valaka Sveda, tight pottery will tie. But in Churna Pinda Sveda, sorry, Tusha Pinda Sveda, the main advantage is we'll tie the knot very loosely, because it can be covered the almost flexible or the where there is directly cannot, the pottery cannot go. So curvature areas, this Tusha Pinda Sveda will directly go, and it is more soft in nature to touch. So that's why this pottery is medium tight in nature, and where the cross or curvature areas are there and neck over there we can easily apply this Tusha Pinda Sveda and easily apply to corners of the neck. So that is, and no need to change it daily. Heat the pottery indirect method and apply over the this one. So indications same as that of the Churna Pinda Sveda or Valaka Svedas. Vata Kapaja, stiffness predominant, and Katigra, Sama Sandigata Vata conditions, Ruksha Sveda, Tusha Pinda Sveda can be used. So another one Pinda Sveda, that is Lavana Pinda Sveda. So what I am telling is, this almost all Pinda Svedas can be used OPD basis, where we can prepare and we can use, because we are day to day in our practices we are getting a lot of almost all joint disorders, spine disorders, and connective tissue, inflammatory disorders, almost all skeletal and neuromuscular conditions, almost all conditions we are encountering the patients in our day-to-day OPD. So these are can be practiced in our OPD. That's why I have concentrated only on this Pindas Vedas more. Okay. So Lavana Pindas Veda, that is commonly used in Amavata or in painful conditions, acute conditions where acute muscle spasm will be there. There Lavana Pindas Veda has been selected first. So here it's a more cost effective. Almost all Lavana is available everywhere. So that is Saidava Lavana. So it is cost effective, easy for the application, and take Lavana every day. Just totally will be changed every day, and it should be indirectly heated. That Saidava Lavana is collected and make it into pottery and indirectly heating, then applied over the affected area. So apply till the stiffness reduces or the muscle spasm is reduces. Usually in acute condition, this Lavana Pindas Veda is very much. So acute muscle spasm conditions and inflammatory changes comes down and pain mildly comes down. So okay, don't it comes down, you stop it. Otherwise, it continues, pain increases. So that's why in acute conditions where muscle spasm is there, use Lavana Pindas Vedas. And come to the Snigdha Vedas, selection of the Snigdha Vedas. We have completed Yokshas Vedas, different kinds. So come to the Snigdha Vedas. So common indications and methods of the Snigdha Vedas. So always it should be applied in Snigdha Vedas in Vata Pradhana Rogas. So Shula Pradhana Rogas, Dhatu Kshayajanya, that is Mausa, Meda, Asti, Kshayajanya conditions, muscular spasm, Karma Kshaya, Vata Vyadis. Where? So in most of the Vata Pradhana, Shula Pradhana, Dhatu Kshayajanya, muscle wasting conditions, muscular spasm and Karma Kshaya, Vata Vyadi conditions, commonly Snigdha Vedas have been selected. In diseases like Pakshagata, Ardita, Sandhigata Vata, Kridrashi, Katishula, Astibhagna, Apabahuka, Kampavata, etc. diseases, this Snigdha Sveda has been selected. Vata Pradhana Kapha Lakshanas, if it is present, there also Snigdha Sveda is selected. All mentioned drugs can be selected for the Snigdha Svedas. It can be used for Sarvanga and Ekanga. That depends on the where we are using and which disease where Sarvanga should be selected or Ekanga should be selected. So prior to the Snigdha Svedas, almost we done the Abhyanga with indicated Sneha. And while giving the Snigdha Svedas, many things are there by applying. Some are squeezing type of Svedas, where by applying and by squeezing along with rubbing, tapping type of pottery Svedas are there over the body. Based on the condition or requirement, we will select the method of applications and different kinds of Svedas. So this is selection of Snigdha Svedas. So first we'll start with Snigdha, that is Patra Pinda Sveda. So all of you know different kinds of Vatahara leaves should be collected and those should be chopped into small pieces, and some lemon and garlic and Haridra methi powder and other powders should be mixed, and it should be heated in a pan and made into pottery applied over the affected part. That is Patra Pinda Svedas. Here Yalakidi is also been told to this Patra Pinda Sveda. So Sveda, where the fermentation is done by heated pottery containing different leaves of medicinal plants. What are those ingredients? Are Eranda Patra commonly we are using, and coconut gratings, and lemon, that is pieces of lemons, and Tilataila for the frying purpose, Eranda Taila, Saindava, Haridra, Rasnadi Churna, Vasapatra, Nirgundi Patra, Arka Patra, Karanja Patra, Shigru Patra, Chincha Patra, and Datura Patra. So almost all these are the Vatahara leaves. Almost all we are getting in our outside environment there. So Vasa, Nirgundi, Arka, Karanja, Shigru Patra, Chincha Patra, Datura, Eranda Patra. These all are available Vatahara leaves, easily available, and then made into chopped into small pieces and made into pottery. So that's why these should be selected while doing the Patra Pinda Svedas. So clinical uses and method of application of Patra Pinda. Usually Patra Pinda Sveda is used in Vedana Pradhanya Vata Vyadis. Vedana. So Kapha Samsurgacha Vata conditions, like Manyashula, Stamba, Katishula, Prushtagata Vata, Sandigraha, Kshagata, Janu Sandigrata Vata, and pain due to IVDP, all of you know, intervertebral disc collapses conditions like lumbar spondylosis, lumbar disc diseases, and cervical disc diseases. This patra potali can be used, and very soft touch with a mild pressure should be applied while giving on IVDP conditions. And if the paraspinal muscle spasm is there, then tapping method should be used. That tapping method should be used. So no rubbing over the applied part, and leaves may be taken as per the dosha involved or disease. So here, once patra potali is made, it can be used for 3 days. Okay. So in Janu Sandigata Vata, mild tapping is required. Sarvanga Shula, tapping method is required. And in spine, soft touch with the mild pressure in a spine region. So this care should be taken while giving the patra potali Swedana different. So main is Vata Kapajanya, Vedana Pradanya, Kapha Sansurgaja Vata condition should be considered for the patra potali Swedas. So next come to the Shashtika Shali Pinda Sweda, that is Navarakiji. So SSPS, Shashtika Shali Pinda Sweda, is a type of Snigdha Brahmana Sweda. So here Shashtika Shali, all of you know, that is Shashtika Shali, the Shali which is harvested in 60 days and made into potali by boiling it with the Balamula, Pata and Chira, made into potali, and that Pinda Sweda, then that should be applied over the body, that is Navarakiji. Cooked Shashtika Shali is used to induce the Sweda here. So why Shashtika Shali has been selected means because this Shashtika Shali is harvested in 60 days and it is very rich in nutrition. So that's why this Shashtika Shali Pinda Sweda has been told rich in nutrition. That's why this is a transcutaneous nutraceuticotherapy. Through the skin, we are transferring the nutrition. So that is transcutaneous nutraceuticotherapy. That's why. So rich in nutrition. So through the skin we are supplying the nutrition. So this is a Snigdha Brahmana Sweda. So that's why transcutaneous nutraceuticotherapy. So it is better, or it is a treatment in which Shashtika Shali prepared in milk processed with Balamula Pata or Brahmana Pata is tied in a bolus. Okay. So here first is ingredients are Shashtika Shali, Balamula Pata, Kshira are the main ingredient. Okay. So this Shashtika Shali is very rich in nutrition. That's why the Shashtika Shali has been selected for the Swedana. So indication of Shashtika Shali Pinda Sweda and its application. It can be applied Sthanika or Sarvadayika. So Sarvanga Sweda. So it is called as Mahan Sweda. And Nirupastambita Vatavaris. Nirupastambita Kevala Vatavaris. This is being used because this is a Brahmana Snigdha Sweda. And Mamsa Shosha conditions where the muscle wasting is there, you should select this Sweda. Sandigata Vata, osteoporotic conditions, Asti Bhagna conditions, and Pakshagata where muscle wasting is more, Ardita, Vataja Meha conditions, and Sthanika if it is there, it is rarely selected. And degenerative conditions like osteoarthritis, osteoporotic conditions, myalgia, and due to the GB syndrome, muscle wasting is there get selected. In fibromyalgic conditions, various types of neuromuscular and musculoskeletal diseases like post-polio paralysis and paraplegia, congenital spastic paralysis, hemiplegia, pseudohypertrophic muscular dystrophies, cerebral palsies, and Dutchman muscular dystrophic conditions where muscle wasting, Kshaya, Karmahani is there, that there where Brahmana is needed, the Shashtika Shali Pinda Sweda can be selected. So in chronic rheumatic conditions, muscular dystrophic and vitamin B12 deficiencies, it can be selected. So here the method of application should be very much needed. Here the tapping method. When we'll apply the body that Sweda, Shashtika Shali, the tapping method along with rubbing also will do, rubbing method. Then in between it should be squeezed because squeezing will leaks that particular active ingredients which are present in the Shashtika Shali, it will comes out. So continuously tapping, rubbing and squeezing method to be followed while doing the Shashtika Shali. So content from the potili should be applied over the body. So after finishing the this 45 minutes of Shashtikashari, so whatever the remaining anna will be there, that is rice, that should be applied all over the body. That is called as annalepa. So after that, annalepa can be done. So after finishing the main important thing here to be noticed is, after finishing the procedure for the 45 minutes, on table kashaya, pati kashaya, gandharvastari kashaya has been given. That is gandharvastari kashaya to be given to the patient. And before starting the Shashtikashali Pindasveda, Amalaki Talam should be done over the head. Very important. Amalaka Talam should be done to the brain, because to protect the brain from excessive heat. Amalaki Talam. Gandharvastari Kashaya, on table Kashaya, it is being told, because they believe that this Shashtikashali Pindasveda ho, yeah, that is Kayasheka ho, that's continuously all over the body we do, continuously Snehana Svedana will happen. Through this, the doshas which are located in the Shaka, they daily will come from Shaka to Kosta by simultaneous Snehana Svedana will happen here. From there, by the liquefied doshas will come to the Kosta. To eliminate it out, the Gandharvastari Kashaya and on-table Kashaya has been given soon after immediately the procedure in on-table Kashaya is being told. So to eliminate that or to evacuate that doshas which are come to the Kosta, Gandharvastari Kashaya or on-table Kashaya or Pati Kashaya has been 20 to 30 ml should be advised to the patient. So Amalaki Talam is before starting the procedure, it should be done. So after all procedure will complete, so after the snana, Rasnadi Churna should be applied to the head to prevent the body from the cold. Okay, so this is the some factors to be considered in while explaining the Shashtikashali Pindasvedas. So benefits of Shashtikashali Pindasvedas: improves the better blood circulations, gives color and complexion, helps to remove the accumulated waste products in different dhatus of the body, and thus activates the Dhatvagnis, increase the body strength and stability. So I told it acts as a Tandrahara, Shramahara, Klamahara, Nidra Pravartaka, Agni Deeptikara, Sroto Shodaka, Angamardhara, Stabda Sandhi Pravartaka, Mala Anulomana, Tushti Pushti and Balaprada. So it is a Snigdha Brahmana Sveda, that's why it is been told. So it maintains the metabolism, may also be reported to prevent premature aging. If in combination with Mustari Apana Basti, we have been practicing this Mustari Apana along Shashtika Shali, so for the premature aging. So more effective in myopathies disease, which are have no better or a complete treatment in modern work. So it will be increase the tone, strength and bulk of the muscles. So we are using it in almost all myopathies conditions. So in article published, that is research CPTR, this one, that a cup of bowl of Shashtikashali, how much nutrition it is contains. So 16.5% higher protein, thiamine 27, riboflavin 4 to 25%, niacin is 2 to 36, dietary fiber 34 to 44%, significant higher phosphorus, potassium, magnesium, sodium and calcium levels were found in the Navari kidney or a bowl of Shashtika. So next come to the Masha Pindasveda. Instead of Shashtika, we can also use Masha. This is also Brahmana Snigdha Svedas. There, instead of Shashtikashali, Masha, rich in lysine protein, is used for the preparations. It contains proteins, fat, minerals, fibers, calories, that is 347, and calcium. So Masha, Chira, Balamula, Mamsarasa are the ingredients. So similar methods of Shashtikashali Pindasveda application, mainly useful in Mamsa Shosha, atrophic conditions, and Kshagata Ardita, muscular dystrophic conditions, and Kasha Rogas. So here, alternative to Shashtikashali, Masha Pindasveda can also be used, but the indications are same. So next, another one is Jambira Pindasveda, that is Naranga Kiji. All of you know Jambira, where we are using lemon pieces. That is Jambira is bigger one, that lemon pieces, bigger Jambira. That is Jambira, you know, that the Sveda given by using the bolus, which is prepared by using Jambira or lemon along with Haridra Churna Manjista, Methi, Khadira, Saindava can be used. So here the jambiras are made into small pieces. Along with that, Saindavalavana, Haridra, Manjista, Khadira, Methi is used, and also some this Nistusha, Lashuna can also be used here. So they are made into potalis frying. After frying, when it turns to golden brown, made into potalis, and that potalis can be applied. So indications of Jambira Pendasveda. So all of you know this Jambira Pendasveda. Now we are using it practically in all stiffness conditions. Where stiffness. So in our practices, what we are using diabetic induced frozen shoulder, where stiffness is more, where ligament tendons involvement is more inflammatory. So there we are using it. This it is having a wonderful result. So in painful conditions like Avabavuka, Viswasi, Rudrishi, Amamata, in a joint stiffness, wherever there is stiffness, we can use this Jambira Pendasveda as having very good results. In frozen shoulder and osteoarthritis stiffness conditions, sprained ligament and tendon conditions, we can use this. And don't rub the potali while using here. Mild tapping is required here, and chance of burning sensation over the applied part is more, so that's why mild tapping is required. And maintain the temperature, and sometimes rashes may appear. So in our day-to-day practices, we are using it wherever stiffness conditions. It is having very good result in diabetes induced frozen shoulder. So easily within 15 days, the range of motion of the shoulder joint will be more, ROM will be more along with the exercise. So this can be applied for 8 days. So we are getting a good result with Jambira Pendasveda. It can be practiced in OPD level. Next is Kukutana Sweda, explained by Bhav Prakasha, especially in Adita conditions. So here in Kukutana Sweda, the Sweda given by using a bolus, which is prepared by using egg yolk, along with the Grutha, Haridra, Saindava, and lemon pieces. So powder of the egg cell is used in astic share, but in Kukutanda we are using egg yolk. Okay, and avoid direct heating here. Indirect heating is best for the preparation. Apply the content over the affected part. Here first of all, lemon pieces, haridra and paila, Saindavalavana has been added. After that, when the lemon pieces will turn to golden brown, you add the egg yolk, and it is fried on the pan, then made into potoli and applied over the affected area. Kukutanda Sweda, especially Bhav Prakasha explained in Ardita Rogas. So here indicated is Ardita, Apabahuka, Manyastamba, Sandigatavata, Katigatavata, and Astibhagana conditions can be used. Especially in practices, we are using it in Ardita, is having a good result. Okay. Next, come to the Chinchalavana Pendasveda, where this can be easily made. That is, main ingredient is chincha pala, that is seed ko nikal ke, that is chincha only, that pulp is used, and Saindavalavana is added, and taila and dhanyamla is used. Dhanyamla is used here. So made into paste along with dhanyamla should be made, and the paste along with Saindava and taila fried, and it is been used. Chincha pala, dhanyamla, taila for frying purpose, Saindava is added and fried till attains a semi-solid consistency. Here the chincha paste is used, and Saindavalavana and dhanyamla is used here. So made into paste. That paste is made into pottery, then applied over the conditions. So Chinchalavana Pendasveda, this is both Ruksha and Snigdha Sweda. So here in Amavata conditions, fine stiffness, Vata Kapha dominant conditions, where Chinchalavana Pendasveda is being used. Another Pendasveda. Next Pendasveda got over. Now come to the Nadi Svedas, where day-to-day practices, where Nadi Sveda. In our practice, what we are using is Nadi Sweda. Main important thing is this is Agni Sweda, in which Swedana is by vapors. So obtained by boiling the Kashayana vessels through the Nadi. The important considered point to be here is different herbs like Eranda, Shigru, Amla, etc. according to doshas, commonly Dashamula we are using. Main important thing here is don't add this Eranda, Shigru, Amla into the cooker directly. So because if anything is blocked in the nozzle or something, the pressure may increase and blasting is more chances are there. So make a pottery and hang it in the that this one, cooker itself. Then you make totally after that you heat it and the vapor will come that you use. So very important in a practice. So Dashamula either end Shigrota, whatever you use, that make into totally and dip it to the cooker with the water. Okay, then you use. Then the chances of blasting is less. So it can be used in Ekanga Sveda. Intensity of heat can be controlled because in Nadi Sveda, the nozzle or a knob will be there to control for the controlling purpose. The intensity of the heat can be controlled over. So that is advantage of Nadi Sveda. We have modified it. Earlier it was different. Now we have modified without altering the basic principles. So we are now using cooker with a pipe with a controlling nozzle. Okay. So curvature of the pipe helps in preventing spilling of the condensed drops. That is advantage. A pressure cooker or the vapor producing instrument may also be used with the required modifications here. Now we are using is cooker itself. Okay. So indication Pakshagata Anga. So here Pradrashi Prashtashula Ardita Manya Stamba. Other indications also there according to the Yugdya of the patient, Yugdya of the Vaidya, he can use it. But the most we are using Pradrashi Prashtashula Ardita Mamsagata Vata Vikara Katishula Pakshagata and Angamarta. So and it can also be used as before Nasha as a Shodana. This Shodananga Sveda, before Nasha Basti, we are using Sandhikata Vata, Katishure, Manishur. Okay. Next, Avaga Sveda, all of you know, that is Dabba. Drava Sveda, it is been told, and Sarvanga Sveda. So it can simultaneously produce the Sarvanga. So this is Dabba. So Kashaya, either Taila, Kshira, Gumutra, Agurvadi Kashaya, Shiri Vraksha, Chandanadi Kashaya, Sharodaka, that is while giving this one, Shilpa wearing Sharodaka, can also be used. Different kinds of Taila, Kashaya, Gomutra, according to the disease wise, we are using here. So usually in Mutrashmari, Asha, Katishula, Prashtashula, Pashashula conditions, this Avaga Sveda has been using. And Pittanamandi conditions, it is contracted, and Amalaki Talam should be given. And also here I told Sarvanga Sveda hai, isliye Gandharvastadi or Pati Kashaya has to be given on table. And after the procedure, Rasnadi Churna should be applied over the head to prevent from the cold. So this is Avaga Sveda. And Parisheka, that is pouring of the different kinds of oil, tailas, dugdha, kshiras over the body. That is also called as Parisheka Sveda, Kayaseka or Pijichil. So it can be Ekanga or Sarvanga. It is comes under Mahan Sveda. So we are using Jala, either Kashaya, Sneha, Tailar Grita, Dugdha, Shira Kashaya, Gumutra, Danyamla, Kanji, Takra, different kinds of Dravadravyas have been using with the different disease conditions, state and stage of the disease. We are using different kinds of Dravadravyas here. The pouring from the 10 to 12 angula height is important. The pouring. So pouring, we are using different kinds of pranadi or tilted hand. Say, the squeezing the taila or dravadravya with the tilted hand squeezing. That is, and different kinds of instruments also we are using. Pranadi are using that is pour from the 12 to 10 to 12 angula height. Sek or pigeon tadaval procedure is also been called. So different varieties of parisekas and with indications, you'll see that. Tailadara, where we are indicating Tailadara in Pakshagata conditions, we are using Sacharadi or Dhanamantram Taila, we are using Kampavata conditions, we are using Shiravala Taila, and Vatarakta conditions, we are using the different kinds of Tailas here. So in Padatala Tarpana improves the vision and Nidra Padashula, we are Shilavala Tala Tarpana. Pada Tala Tarpana, application of the Taila to the Pada. Because Pada Tala Tarpana improves the vision and Nidra Padashula. And in Dhanyam Ladara, we are using in Amamata, equalizing spondylosis and Dhatukata Ama conditions that Dhanyam Ladara, this is Ruksha Sveda. And Kshiradhara, Vatarakta conditions, Pitta Prokopaka, neuritis condition, Kshiradhara has been selected. and Gomutra Dhara, Amavata and Katigraha conditions, and Kashaya Dhara, Kapha Samsrishta Vata Valis. Kapha Samsrishta Vata Valis is selected. Chinchadara has been Amavata and Katigraha conditions, and Takradara, psoriasis, skin disease involving any kind of scaling disorders where the Takradara is been selected. So these all are different kinds of Parisheka Svedas where we are using in day-to-day practices. And methods all of, based on the need and select, we are using Kumbi, we are using Pranadi, we are using Varshulika. Varshulika is nothing but pouring with a different pores. Shata, that is Sasra, pores will be there. And Pranadi is just a pipe or a bamboo-like structures, that is Pranadi with the help of pipe. And Kumbi all of, with the mug or this, or a squeezing or cloth, sponge, mug, we are using different kinds of instrument we are using for the Seka purpose or digital purpose. So continuous pouring is very important. Maintaining of the same temperature should be considered here. Covering the silk cloth. Amalati talam is very important to prevent the head from excess heat. So usually Takradara conditions, usually chills may appear, the care should be taken to the patient. So if immediately chills occur, stop the procedure. Amalaki talam, Lalata Sweda, until the Lalata Sweda, you should carry out the procedure. And Pati Kashaya, I told you that Gandharvastadi Kashaya given soon after the procedure, 30 ml, 3 ml, 30 ml. And Rasnadi Churna applied over the head immediately after the bath. So these all are the care that should be taken in Parishek or digital conditions. Next is Upanaha Sweda. All of you know, Upanaha is Bandhana, Charmapata. That is the different kinds of churnas will take and made into paste and it heat and it should applied over the affected area for the 12 hours. That is Upanaha. That is Upanaha Bandhana. That is called as bandaging or poultice. Application of warm kalk of Vatara Dravyas with Amla Dravyas, Vedega, Lavana, Sneha, and Gudumadi Upanaha, Salavana Upanaha, Nimbapatra Upanaha, Masha Saindava Upanaha. So different kinds of upanahas are there with the different conditions we are using it. So in Pittanubandhi, if it is there, you select Kakoladhigana drugs and made into paste and apply over the affected area, or Padmakadhigana. In Kafanubandhi Vata is there, you select the Surasadhigana. In Vatanubandhi is there, you select the Vachadhigana. So these are dosha based Ghana should be selected in Upanasveda. So there are three types of Upanasvedas are Pradeha, Sankara and Bandhana. Main important thing is here the poultice is done, that is the Upanasveda is done 12 hours. If you tie night at 8 p.m., you should remove it 8 a.m. morning. So 12 hours this Upanasveda should be tied over the affected area. Usually joint conditions, ankylosing spondylosis, lumbar spondylosis conditions, we are using it. Indication that is Atyanta Ruja conditions, where pain predominant, Sandhi Stabdata, Sandhi Shodha, joint division conditions, arthritis, bursitis conditions, frozen shoulder, ankylosing spondylosis, shoulder subluxation in stroke patients, we are using it. That is Upanasvedas. That is poultice. Another one is Lepa, that is Agni Lepa. I am telling about the Agni Lepa. Different kinds of Lepas are also there. So Agni Lepa is commonly using it in Pakshagata conditions, where the whole body or half of the body is covered with Agni Lepa. So Pralepa, Pradeha, Alepa, or different kinds of Doshakna, Vishakna and Varnak are the different types of Lepas has been explained in the text. Okay. So the drugs which are Ushna Tikshna Dravya should be selected, like Lashuna, Lavanga, Maricha, Sarshapa, Haridra, Chincha, Nirigundi, Tulasi, Yeranda, Shigru, Papata, Banda, and Agnimanda have been selected. So Badaradi Lepa in knee joint division is selected, and either Gradumani in knee joint division. But for the Agni Lepa, Lashuna, Lavanga, Maricha, Sarshapa, Haridra, Chincha, Nirigundi should be selected. So apply Kalka in Pratilomagati, upward direction. The Kalka should be applied all over the body. Then the thickness of the Kalka should be 0.5 centimeter. That is Ardra Mahishavat Charmavad. Ardra Mahisha, that is wet Mahisha Charmavad. That is approximately 0.5 centimeter. and similar to Niragni Upana Sweda itself, and practiced in Avarna Janya Pakshagata, Vata Kavacha, that is Amavata condition, Samayukta conditions, Agni Lepa is selected. Chances of skin irritations is there, rashes is there. If immediately rashes arises, stop the procedure. So this is Agni Lepa is commonly utilized in SDM Urabi, or we are also using it Agni Lepa in Pakshagata, Avarna Janya Pakshagata conditions. So lepa I told no different kinds of lepas in different conditions I told. Patumchikadi churna lepa we are using in pain and inflammation caused due to morbid vata and kapha. Jatamayadi churna, that is gout swelling associated with pain and inflammation, burning sensation caused due to morbid vata and pitta. Rasnadi churna, pain and inflammation, swelling in spine and joints. Polapulatari churna is used in the pain, stiffness, swelling caused by morbid kapha only, because vata kafara. Nagaradi churna, pain, swelling caused due to morbid vata. Dashanga churna in edematous or inflammatory swelling associated with pain and burning sensation. Dashanga churna. So with the different lepas, with the different conditions, stage of the disease, we are using different churnas to treat the diseases with the different lepas. So these are different churnas with lepa. So this is Bashpa Sweda. So Bashpa Sweda, all of you know this Sarvanga Sweda. At that time we will get the Sweda. So all of you using this, I think sitting or lying posture में मिलता है इसको आपको. Then here before going for the Bashpa Sweda, आमला के talam is important. The Bashpa Sweda is given, the Sweda box will be there. There you will give the Sweda, will induce the pipe there, and the vapors will come, and almost all immediately at that time Sweda will occur. Until the Lalata Sweda appears, the patient should be always sit in the chamber. So one thing is very important here, the sudden shock due to the dehydration may occur. Always ask the patient, always you should talk with the patients whether we are getting sweat or not, we are comfortable or not while giving Bashpa, because suddenly when the patient wake up, suddenly patient may get a giddiness. We are experiencing most here in diabetic conditions or some conditions where the patients where more exhaust will be there. So before patient coming out from the chamber, give him a glass of water, then patient relax the tell him to relax. After that he can come out. That's very important, practical. So benefits is persistent uniform heating of the every part of the body, useful as a purvakarma to Swedana. It is Vata Vyadhi. Generally after Sarvanga Bhanga it is used. Softness and brightness the skin, less time consuming usually. Excess dehydration, fainting may happen. That is very care should be taken. So Kshiraduma, the last one, modified Sweda, that is Kshiraduma, where we are using Kshira as a main drug. Due to that boiling, that vapors will come, that is Kshiraduma. Modified Sweda Karma, effective in Murda Jatrugata, Balamula Kashaya, milk and water are main ingredients. Bang over the face, neck region, and cover the eyes and pass the vapors to tube over the face and open. So Urdha Chaturgata Vikaras, if it is there, Kshiraduma is indicated. Till the face sweat completely, you give the Kshiraduma. Ardita, trigeminal neurologic conditions, Hanugraha, Viswachi, Manyastamba, Avabhavuka, lock, that is the way of jaws, mastoiditis, cervical spondylosis condition, Kshiraduma is being told. So last Panasapatra Sweda is usually that Panasapatra is heated and applied over the body, that is bang over the face. After that Panasapatra heated on a pan containing little oil, mainly used in ardititis. Chances of burn with not seen temperature. So directly heating the Panasapatra and applying. This is Panasapatra Sweda. Ishtika Sweda, all of you know. Usually we are using Ishtika Sweda, that is Agni Sweda, Bashpa Sweda. Brick or kanji, thick cloth vessels are needed. Instead of brick, stone can also be used. Usually plantar fasciitis condition in Vata Kantaka, fasciitis, calcaneus spur conditions, Ishtika Sweda is being used. Okay. So this completes all the Swedas almost we have covered. Points to remember while giving the Swedas. Should not do Sweda without the Abhyanga. This is must. And Mrudu Sweda should be given in Hridaya, Vrishna condition, that is Vrishana, and Netra should be covered. And Madhyama, Mankshana. Madhyama Sweda given Mankshana. Mahan Sweda should be, Amalaki Talam should be always keeping, that is Talam, Amalaki Talam over the head. Cotton pad dipped in the cold water kept over the vertex. Anulomanottar, that is Gandharvastadaya Kashaya should be given in almost all Mahanar, that is Sarvanga Sweda conditions. Important. Avoid Sweda in Pitta, Kleda Pradhanyavyadis like Kusta, Meha and Staulya. Ushna Jala Snana is in above conditions. Old age at most care should be taken. Giddiness is common in Pitta Pradhana, hypertension, diabetes conditions. If hungry, this giddiness is common, so care should be taken. Check the temperature of the potoli before apply to avoid the burns. Careful administration in diabetic nephropathy conditions where the patient cannot feel the heat sensation. That care, at most care should be taken. Paresthesia conditions, lepromatous reasons, the utmost care should be taken. Observe the subsiding of the Shita, Shula, Stamba, Gaurava, Lalata Sweda should be observed in each and every Sweda. So, this Parihara Vishaya, what should be followed during the Swedana Karma? Avoid exposure to cold is extreme light, avoid drinking cold water, avoid day sleep, and avoid the cold water bath, avoid dadi, disease-wise foodstuffs, avoid traveling after the procedures, don't expose to the cold. So these are common Parihara Vishayas to one should follow immediately after Sweda and during the course of Sweda. So some little highlight on mode of action of Swedana. All of you know the Swedana karma will liquefy the doshas due to its Ushna Tikshna properties, regulates them towards the GID, that is from Shaka to Kosta. Same are removed from the body by Shodhana. So what Swedana does is Tambahara, Gauravahara, Swedakaraka. Functions of Sweda is Vata Niyamana, it controls the Vata, Dosha Dravata, Bhatri Vinamana, Agni Deepana, Tak Madhava Prasadana, Bhakta Shraddha, Shoto Vishuddhi, Nidra Tandra Karaka, Sanji Cheshta, Dosha Shodhana. So these are functions of the Swedana Karma. So how the dosha or how the mechanism occurs during the Swedana? What are the mechanisms will occur during the Swedana? Increased metabolic rate will be there when we apply the heat over the body. So while doing the Swedana, this increased metabolic rate will be there. After that, vasodilatation will be there. Then stimulation of the sweat gland will be there by stimulating hypothalamus or this one. Okay. So first sweat mechanism, all of you know, when the core temperature will increase, that thermoregulation in hot temperature, the warm blood, that is core temperature increase when that warm blood will through the receptor go to the hypothalamus. That hypothalamus, when the core temperature increased above the 37 degrees Celsius, that stimulate the sympathetic nervous system, then that will open the sweat glands and generate the sweat. This is the sweat mechanism, physiological. So increase in metabolic rate. How? Swedana increase the body temperature, then increase the sympathetic activities. This will stimulate the epinephrine, norepinephrine, thyroid hormones releases. Then it again increase the metabolic rate and stimulate the lipolysis. So increase demand of oxygen, increase the output of waste product. It can be correlated with digestion of ammonia. Okay. Vasodilatation will happen, increase the body temperature, negative feedback, stimulate the thermoreceptors, send a nerve impulse to the preoptic hypothalamic area, stimulate the heat to losing the center or inhibit the heat promotion center, dilatation of the blood vessels, increase the blood flow to the area, maximum O2, nutrition to the particular part, and removal of the waste product. This is can be correlated with Srothamukha Vishodhana. Next is stimulation of the sweat glands. Increase the body temperature. When the core temperature increases, it stimulates the sweat glands via hypothermic action of sympathetic stimulation, sympathetic nerve stimulation, increase sweat production, more waste removal. Swedana corrects the Swedava Sroto Dushti. So this can be correlated in this manner. So next come to the scope of the research where we can do some researches in Swedana. the effect of serum electrolytes after Swedana, lipid profile in Sapanga Bashpa Sweda immediately after Swedana, what are the lipid changes because lipolysis will happen there and some electrolyte imbalance will happen or not to see that serum electrolytes can be done to assess the effect of cystic salipindas with a neurogeneration, regeneration and vitamin B12 deficiency, developing the subjective parameters to evaluate the effect of different amla dravya such as kanji, mulaka kanji and vinegar in instead of that is amla dravya. Assessment of mala nirharana through sweat analysis. Example, smoker sweat is yellowish and contain nicotine. If we give continuously Swedana to the chronic smokers, the sweat will comes like yellowish. So that can be assessed or analyzed for containing nicotine or what. That can be analyzed for the scope of the research. Comparative clinical study to evaluate the effect of different churnas used in Churna Pindasvedas, effect of cystic salipindasveda on blood sugar level, standardization of instrument used in Swedana Karma, anti-inflammatory properties of Sweda with respect to ESR and CRP, inflammatory markers. To conclude, along with the knowledge of Swedana knowledge of the procedure, also very much important, physician can select the different drugs in the procedures based on the involvement of dosha, dusha and yukti of the patient. It's very important to select the dosha according to dusha, according to state and stage of the diseases. Different kinds of Swedana has been selected. That is yukti, depend on the yukti of the physician. Classical procedures can be modified without altering the basic concept to give scientific approach. So biochemical changes, hormonal assay can be studied to understand the mode of action. So if any queries, they can ask. And thank you. Thank you very much for the patience hearing and thank you for the opportunity.
Thank you so much, sir, for such a wonderful, insightful, and knowledgeful session. Really, it was a mind-blowing session, sir. And if any queries, I would like to request participants. You can post your questions in the chat box. And one question is already in the chat box, sir. That is, how can Swedana help in vitamin B12 deficiency, sir?
So it is will be helpful in vitamin B12, that is Shastikashale, high nutrition. So vasodilation will be there and nutrition supply will be there. So that's why I put it in that scope for the study. So many people have seen to increase in the vitamin B12 deficiency conditions. We have seen that with increasing the HB level, so intrinsic factor vitamin B12 will be there. That why. So I put it into the research protocol. That's why it can be studied in a by assessing the vitamin B12. So we have seen HB increase. Okay. So that's why I put it in a research. So it should be researched vitamin B12 before and after the treatment of cystic salipindas. We have seen that.